Hey there. Let's talk about something that affects many men, but not everyone feels comfortable discussing: sexual health. It's a topic that's often kept quiet, but it's important to address. Did you know that most people experience some form of sexual health problem at some point in their lives? And yes, this includes men. Today we're diving into common issues like erectile dysfunction, low libido, premature ejaculation, and much more. We'll explain what causes them and how they can be treated. So, let's get started. Sexual health problems like difficulty with erections, ejaculation, or even a lack of sexual desire can happen to anyone at any age. These challenges may be triggered by things like medical conditions, medications, stress, or even relationship issues. But here's the good news. Most of these issues can be treated with the right help. So, what exactly is sexual dysfunction? In simple terms, sexual dysfunction refers to any issue that disrupts or prevents someone from having a fulfilling sexual experience. It can affect sexual desire, arousal, and orgasm, making things feel frustrating or discouraging. But here's the key point. Sexual dysfunction is treatable. With the right care and guidance, most men can get back to feeling like themselves again. Now, let's break down some of the most common issues that men face. Erectile dysfunction. First up, erectile dysfunction, or ED. It's the most common sexual issue men report. ED is when a man struggles to get or maintain an erection that's firm enough for sex. This can happen occasionally or frequently, and it affects around 30 million men in the U.S. It's often linked to health conditions like diabetes, heart disease, or stress. Erectile dysfunction, or ED, is when a man has trouble getting or keeping an erection firm enough for sex. It's the most common sexual issue men report. This can happen occasionally or frequently, and it affects around 30 million men in the U.S. It's often linked to health conditions like diabetes, heart disease, or stress. It can look like this: inability to get an erection at all, achieving an erection, but it doesn't last long enough for intercourse, getting an erection sometimes but not consistently when desired. ED can often be a sign of another health condition. For example, men with type 2 diabetes are 2 to 3 times more likely to experience ED than those without diabetes. It's important to know that ED doesn't just affect older men. It can happen at any age. The good news? If you're dealing with ED, there are several treatment options available to help you get back on track. Your doctor may recommend lifestyle changes. Simple things like regular exercise, a balanced diet, and quitting smoking can make a big difference in improving erectile function. Medications. Some medications like Viagra help increase blood flow to the penis. If low testosterone is contributing to ED, your doctor may prescribe testosterone therapy, penile injections, or suppositories. In some cases, medication is injected directly into the penis or inserted into the urethra to help achieve an erection. These treatments may include drugs like alprostadil, penis pumps. These devices help create and maintain an erection by drawing blood into the penis, making it firm enough for intercourse. Surgery. If other treatments don't work, surgery may be considered as a last resort. This can involve the insertion of penile implants to provide a permanent solution for achieving an erection. Low libido. Next, let's talk about low libido, also known as a low sex drive. This is when someone just isn't interested in sex as much as they usually are. It could be caused by medical issues, stress, relationship problems, or even low testosterone levels. If you're experiencing low libido, there are several treatment options your doctor may suggest to help improve your sex drive. These include testosterone therapy. Studies show that testosterone therapy can be effective for men with low testosterone levels, boosting libido and overall energy. Medication adjustments. If your low sex drive is caused by medication, your doctor might recommend switching to a different prescription to help restore your desire. Treating underlying conditions. Sometimes issues like an underactive thyroid or other health conditions can affect libido. Treating those can have a positive impact on your sex drive. Exercise, physical activity can do wonders. Exercise has been shown to help men with low testosterone manage low libido, relationship stress, and even body image concerns. Therapy or counseling. If relationship difficulties or mental health challenges are contributing to your low libido, therapy can be a great way to work through those issues and find solutions. Premature ejaculation. Premature ejaculation, or PE, is when a man ejaculates sooner than they would like during sex. This can be frustrating and impact both physical and emotional well-being. So what causes PE? It can happen due to low serotonin levels in the brain, which can reduce the time it takes to ejaculate. Conditions like depression and stress, anxiety about sexual performance or lack of confidence, relationship issues, or even aging. If you're struggling with PE, it's important to know that you're not alone, and there are treatment options available to help. PE can affect not only your physical health, but also your mental well-being and relationships. If premature ejaculation is affecting your relationships or mental health, talking to a doctor is a great first step. They may recommend several treatment options, including psychological therapy or counseling. If emotional issues like stress or anxiety are contributing to PE, therapy can help address the root causes. Behavioral therapy. This type of therapy can teach techniques to delay ejaculation, giving you more control during sex. Kegel exercises. Strengthening the pelvic floor muscles with Kegel exercises can improve control and reduce the likelihood of premature ejaculation. Medications. Your doctor may prescribe medication that helps balance serotonin levels in the brain to extend the time before ejaculation. Topical numbing creams or sprays. These can be applied to the penis to decrease sensation and delay ejaculation. Delayed ejaculation. Delayed ejaculation, also known as inhibited ejaculation, is when a man finds it difficult to ejaculate at the moment of orgasm. It could take an extended amount of time to reach climax, or in some cases ejaculation may not happen at all. It's not an uncommon issue, and there are several reasons why this might occur. If you're experiencing delayed ejaculation, treatment options are available. The first step is to consult with a healthcare professional. They may recommend changes to medications, therapy, or other treatments to address any underlying conditions. Therapies like counseling or switching medications may help. For some men, using a vibrator or other devices to stimulate the penis can be effective in triggering ejaculation. Retrograde ejaculation. Now let's talk about retrograde ejaculation. This condition happens when semen flows backward into the bladder instead of being expelled through the penis. This can lead to little or no ejaculate during orgasm and cloudy urine afterward. Retrograde ejaculation may be caused by certain medications, including antidepressants or drugs used for urinary problems. Surgical procedures, such as prostate surgery, can also interfere with normal ejaculation. Nerve damage from conditions like diabetes or multiple sclerosis is another possible cause. For retrograde ejaculation, treatment may involve switching medications or using a type of drug called sympathomimetics. These medications help stimulate the release of noradrenaline, which narrows the urethra and prevents semen from flowing backward. If the condition is caused by medication, stopping the drug usually resolves the issue. However, if retrograde ejaculation occurs after surgery, such as a prostate procedure, it may not be reversible. What causes sexual dysfunction? So what causes these issues? Mental health, such as depression or anxiety, can play a huge role. Physical health conditions like diabetes or hormonal imbalances can also contribute. And of course, age can impact sexual function as well. But no matter the cause, there's always hope for improvement. How to prevent sexual health issues? Prevention is key. Maintaining a healthy lifestyle through regular exercise, eating well, and managing stress can make a world of difference. And if you're dealing with an existing health issue, keeping it under control is crucial. If you smoke, drink excessively, or use drugs, cutting back could improve your sexual health too. If you're experiencing sexual dysfunction, it's important to reach out to a healthcare professional. You don't have to go through it alone. Doctors are there to help you find the right treatment options, and there are resources available like Planned Parenthood and the National Institutes of Health. Remember, sexual health doesn't just affect you, it impacts your relationships too. Talking openly with your partner and considering therapy can help improve both your sex life and emotional connection. Summary. To sum it up, sexual dysfunction is common and it's treatable. Whether it's ED, low libido, premature ejaculation, or another issue, there are solutions available. Take control of your health, talk to a professional, and don't hesitate to ask for help. Thanks for watching. Remember, you're not alone in this journey and there's always help out there. Stay healthy, stay informed, and take care of yourself. See you in the next video. Subscribe our channel for more health tips.